Well, I want to begin by thanking Susan Prescott, Brian and Sue Berman, Rick Scott, Alan Logan, and all the others at NOVA for organizing this remarkable conference. And to say it's just such an honor for me to be included alongside all the amazing presenters assembled this event. I've just been so touched and inspired. I also want to say how refreshing it is to be among scholars and activists who've not been afraid to professionally color over the lines and to engage in highly transdisciplinary research and work. As we've heard over and over again at this conference, the planetary health problems we're facing are highly complex, and the simplistic, reductionistic thinking alone is not going to suffice in guiding us to sustainable solutions. Rather, systems thinking, respecting complex interactions and emergence, leaning on different ways of knowing, and respecting diverse societal and cultural values are going to be required to both help us more fully understand the richness of the challenges we're facing, as well as crafting some possible solutions. My own nonlinear journey has led me to appreciate transdisciplinary thinking. Inspired by a love of nature, I began my professional career as a research scientist in evolutionary biology of plants, forest ecology, and climate change research. However, after about 20 years of this work, I made a significant career shift to pursue a second long-standing set of interests in Asian philosophy, healing, and martial arts, which led me to the Osher Center for Integrative Medicine at Harvard Medical School, where for the past 20 years or so, I've studied the health benefits of mind, body, and related integrative therapies. Both my training in ecology and Asian philosophies wired me to think in terms of systems and to not only look for complex negative interactions that can impact health, but also for positive cross-system synergies that can enhance health at multiple scales. So for my short talk today, I'm going to highlight 3 examples of how mind-body training can go beyond improving the health of individuals and can have broader impacts related to planetary health through reduced use of the medical system, which, as many of us know, is a significant contributor to environmental waste and degradation, and going to the comments that Helene mentioned earlier about prevention and many others, through enhancing pro-social behavior and cooperation in groups, which we know we can't do any of this alone. We really have to cooperate and have group think, and through softening and dissolving our own sense of self, and potentially leading to a greater appreciation and respect for nature through that, which I think has been a really constant theme throughout this conference, the spirituality piece. And again, Helene talked about the contemplative practices. So I think most people listening to this talk today know that while we all appreciate the values of hospitals, keeping people out of the hospitals is not only good for them, but also good for the planet. If you rank all the countries, nations in the world in terms of their contributions to greenhouse gas emissions, Korea is 12th, United Kingdom is 13th, and somewhere between those two, 14th, is the US healthcare system. Tremendous amounts of waste and contributions to gases and pollutants. So anything we can do to keep people out of the hospital is good for them and good for the environment. I'm going to focus a little bit more on Tai Chi here because it's an area I have some experience in, but I think you can replace this for a lot of contemplative practices, including yoga, meditation, and all sorts of other contemplative dance, etc. Helene talked about whole system health and using multimodal approaches. And one of the things about these mind-body movement practices is that they include a lot of different components. You have movement, you have self-awareness, you have breathing, you have visualization, imagery, you do things in groups, there's a philosophy involved. And because of that, many of these practices have very broad system effects affecting multiple systems simultaneously. Some of the ones that there's good evidence for with respect to Tai Chi are falls, preventing older adults from falls, and I'll come back to that one specifically. Chronic musculoskeletal pain, huge burden on the healthcare system in individuals. Tai Chi seems to be effective in terms of back pain, neck pain, osteoarthritis of the knee, a number of cardiorespiratory diseases, COPD, heart failure, reducing the symptoms. People with heart failure go in and out of the hospital and COPD quite regularly. Anything we can do to reduce the symptoms and decrease the burden on the system is great for both ends. There's not as much strong evidence, but there's growing evidence and research invested and understand the effects of mind-body practices on cognition. And we know dementia is just a huge burden to society and to hospital systems, and anxiety, mood, and all sorts of mental health issues. Just to pick fall prevention as a good example, there's some really robust research in this area. This is a study by Fuzhong Li out in Oregon. It's a robust 3-arm randomized trial comparing Tai Chi to other multimodal exercises, including aerobics and strength training versus a seated stretching. And what they found is after 12 months, 6 months of formal training, 6 months follow-up, the amount of injurious falls was reduced by 50%. That's remarkable. And the amount of serious injurious falls, and both of these are what lead people to the ER and some to extended care facilities, was reduced by 75%. About 1 out of 3 adults over 65 fall every year. And so this is a huge public health issue. It's estimated that non-fatal falls cost US society alone more than $50 billion a year, which again, keeping people out of hospitals is a good idea. One of the other ways that these mind-body practices have secondary effects is through self-efficacy. In our heart failure studies, some studies led by Gloria Ye at the Osher Center, not only did we improve symptoms of heart failure and quality of life, but people reported wanting to exercise more. And they described this as sort of like a gateway exercise. Many of them were afraid to participate. They were deconditioned, and Tai Chi not only gave them the confidence to do Tai Chi, but to do other exercises. Some even started riding bikes. This is a quote from one of our qualitative studies. One woman wrote, "I do more now. I'm riding the bike on a daily basis. I start off doing a little Tai Chi, loosening up my body, and then I get on my bike." And that's relevant for this next slide. And this is a shift now, another example of tapestry or mosaic thinking that we've been talking about. This is some modeling work done at the University of Wisconsin about people really thinking in a systems way. And their premise was driving short distances in urban areas when your car is not warmed up, especially, can have huge impacts on public health in 2 ways. One, directly through the pollution, the particulate matter that might exacerbate asthma and other conditions. And 2, by reducing the opportunity for physical exercise. And so they did a simple back of the envelope modeling exercise, maybe more than back of the envelope, in 11 Midwest cities that included about 31 million people. And they said, what would happen if these people, for half of those short trips under 4 kilometers, rode a bike or walked instead of driving? And what they found was that they modeled the estimate reduction on the healthcare system to about $4.5 billion just for the reduction in cardiorespiratory impacts of pollution. Then they modeled the benefits of doing exercise as another 3.8 million. So just this small behavior change that we're talking about, having people just half the time walk or ride, reduced $8 billion in medical costs just in this one catchment area. So another area that I wanted to just touch on in this very short talk is there's growing evidence, and we all know this empirically, but there's growing scientific evidence now that practicing contemplative practices makes you nicer. It increases pro-social behavior. It's a nice review done by one of our fellows at the Osher Center. And there's a growing literature in this. And I'm just going to pick one of my favorite studies. This is done by Gail DeBoard, who was at Harvard. Now she's the one of the scientific directors at the Mind and Life. And she asked a simple question. This is a 3-arm randomized trial where people either receive mindfulness meditation, compassion meditation, or some waitlist or a waitlist control. And it was really fun design. So at follow-up, they came in for the neuroimaging test, and they structured the room as a setup, the waiting room. So people, there were 2 people seated in 2 chairs. There were 3 chairs in the room. So the study participant came in and sat there. And then a plant came in with a disability. And the question was, how long would it take for the study participant to get up and offer their seat to show kindness? Does being in this study change your kindness from baseline to follow-up? And what they found was yes, people who were exposed to these practices actually became kinder in a very objective, quantifiable way. So the next piece is, does this kindness to others extend beyond the human species? And there's a small amount of data on this that's growing, and we've heard a bunch of it here. We've heard about how nature affects us, but we don't know as much about how these practices affect our relationship to nature, which is part of that big behavior change. Many of you have heard the concept of biophilia that was developed by E.O. Wilson. This is me all the way in the right-hand corner as a graduate student. I had the privilege and honor of being a teaching fellow with E.O. Wilson. And not only was he an incredible scientist and conservationist, but just one of the kindest human beings. And he just passed away. So I just wanted to show this in honor of all he's done. So there's a couple studies out there that are suggesting that contemplative practices, increasing your mindfulness, leads to a deeper connection to respect and a behavior that makes you more actionable for doing things in support of environmental issues. There's a really beautiful paper that just came out by Christine Wamsler. It's on the Mind and Life website, and it's called What the Mind Has to Do with the Climate Crisis, and I highly recommend it. So I just want to finish up with this one quote here. I need to change my screen. This is part of a qualitative interview by Yang, who did some work in the Midwest. And this population, randomized trial, were not new age people. These were 60 to 80-year-old women, primarily Christian churchgoers. And they're describing the experience of doing a meditation or a little qigong where you sort of picture yourself in nature, much like Scott was having us do, and imagining that energy supporting us. And this woman wrote this so beautifully. Tai Chi gives a way to create a spiritual moment that is also very helpful. I'm more aware of my spirituality. I never would have thought, when you're doing our meditation, you look out there and you see this beautiful tree, that's God's energy. It's going to be part of me. Like when you do that washing your organs, as I was saying, Qigong, and gathering energy with your hands. That's God's energy washing through me. And then she said, it's something that offers an opportunity for connecting myself to a spirit within that is part of a bigger whole. So operationalizing this. So to finish up, there's some ideas that we're exploring. We're just starting this program at the Harvard Medical School with Atra Nusrat, who's going to speak next, on linking integrative medicine with planetary health. And in my own work, there's 3 questions I'm really curious about. Can we take these really popular and widespread mind-body practices, MBSR, Tai Chi, yoga, and enhance the psychosocial piece? We know that people feel connected. Is there a way of teaching that enhances that particular outcome, which feeds back on their own health, but also making them more pro-social and maybe more pro-environmental? Maybe by teaching dyadically, people interacting with each other, more touching, group discussions, etc. We haven't really done research on how to teach this to target these sorts of outcomes. The same with biophilia. What's the difference between teaching this out in nature, combining these mind-body practices with explicit information about outer ecology as well as inner ecology? And then we're also developing some healthcare programs to teach healthcare providers not only about their own resilience, but to bring them out in nature to benefit from nature's impact on their health, but also to use that time to teach them about planetary health so that they can be our ambassadors to their patients. So to finish, and many of us know this phrase, think globally, act locally. One of the things that's coming out of this work is to think globally and act extremely locally. That is, do your practice, do your spiritual work, contemplate your navel. So thank you for your attention.